Good afternoon, everybody. If you can hear me, can you type into your questions box that you can hear me okay? Just want to make sure everybody's there and they can hear me all right. Good. We'll go ahead and get started here in about a minute or two, guys. All right, folks, in the interest of time, let's go ahead and get started with our walkthrough / presentation of this year's monthly activity report for our CPOP grantees. So thank you all for joining us. And let's go ahead and get started here. So the agenda that we're going to be going through is going to be a quick introduction. What's going to happen is I'm going to go through a little bit of the logistics, the timelines and details around the monthly activity report. I'm going to flow through the functions of the actual link so you guys can see how it works. I'll attempt to go a little bit slower doing that, and so you can see how everything is functioning. Along the content and the purpose, Jessica is going to, one of our rocks is going to go over, we've created a supplemental guide that will go along with the actual link. And she'll go over the supplemental guide and go over, you know, what this guide is meant to do, the purpose of the guide. And also we're going to go through a few scenarios and walkthroughs with you guys so you can have some sort of little bit of flavor of how this is going to work on your guys' side. So that's a little bit of what we are going to do during our presentation. Everybody is on mute, and we'll have a time to ask questions as we move through everything. So at the end, we'll have a question and answer portion that Jess and I can help answer any of your questions. And also, you can also type in questions at the end of our presentation if you like to do that also. So again, my name is Perry DeJody, and my cohort and my coworker on the business team is Jamie. What I will be referring to a lot during this presentation is our CP business inbox. I can't really reiterate this enough. If you have questions about anything that has to do with the monthly activity report, it's going to be funneled through our CP business inbox. So we can manage it as we receive in questions. So,
hey, Perry.
Perry.
Yeah. Can everyone hear us?
Yep, I've sent out. Everybody can hear me. It says I can hear you.
Okay.
It looks like everybody can hear me. Okay.
Okay. I got a message from someone. I just wanted to make sure.
Okay. Okay. Yep. Everybody looks like we can hear me. Yep. So, excellent. So we'll go ahead and continue here. So let's talk a little bit about the timelines and a little bit of details around the timelines and the due dates. So the first day of each month, you'll be sent a link. This link is going to be sent to contacts within your organization. Now, I got these contacts through the process of contracting. Organizations gave me contacts. I've added those to the list. Feel free to send any other type of contacts you would like to receive this link to our CP inbox, and we'll update that as we move forward with sending out these links. So if you have somebody in your office that would like to receive a link, please let us know. Give us their name and their email address, and we'll add them to the distribution list. You can also, on your side, forward the link to anybody within your organization to fill out. So that is not a problem. If it's sent to you and your organization, you can forward it within your organization to fill out. That is also okay to do. So again, you'll be sent a link on the first day of the month. So tomorrow you'll be getting a link from us. And you'll get the first reminder on the 15th, and that is the due date of your monthly activity report. But you'll get a reminder if your organization has not sent in or submitted an activity report. If you have not submitted it, you'll get a reminder on the 15th. Now, if you're like, we'll do that later, and you forget, you'll get another reminder a week after the 15th saying, oh, hey, you guys, you need to submit your activity report. Here it is. If you lost that link or can't find it, email the CP inbox, and we'll get you another link to fill out your monthly activity report. So that's basically how it's going to go. The first of the month, the first day of the month, you'll get the link. You'll get a reminder if you have not submitted your monthly activity report on the 15th, and you'll get a second reminder a week after the 15th if you have not submitted it. If you submitted it and you feel like you've submitted it, and you get a reminder, email CP inbox. We'll jump in to see what happened. We'll contact Deloitte, see if they've received it. We'll go through our due diligence on our side to help you out as much as possible. So in essence, that is kind of the basic timeline in regards to the link you'll be receiving for the monthly activity report. So I just want to let you know, there is really no option or functionality to print off your submission results. So if I wanted to print off what I've submitted, it's not able to do that. So on your side, please keep track of your numbers that you've submitted, and so you have copies of that. If you need to resubmit a report, or you've submitted data that is not correct, or you need to update anything, email the CP Business inbox. We'll take a look at what your request is, and we'll work with you to get you either another link, or we'll take your updated data over email, and we'll work with Deloitte on their side to update their data. So, but anything, if you need to resubmit anything, if you need to update any of the data that you've submitted for past months, because that does happen, please email our CP inbox, and we'll go ahead and take care of that with you. I want you guys to remember tomorrow's link that will be going out will give you the ability to submit July, August, and September's monthly activity report, all 3 months. November 1st link will only give you 1 month moving forward. So that's traditionally how it's going to happen. November 1 link will give CPs the ability to submit October's monthly activity moving forward. So the anomaly will be tomorrow's link when you get it, because you'll be able to submit 3 activity reports, July, August, and September. And that will go out tomorrow, October 1. So let me take a walkthrough at this point in time. I'm going to go through the functionality of this, this link. So you'll be getting a link that looks somewhat like this. Go ahead and click on it. And here is the first page. It will notify you this is July, August, and September's report. And there'll be a little drop-down box right here, all 3 months. Again, moving forward, it's going to be only 1 month. But this is the one anomaly that you'll be submitting 3 different months. So I'm going to go ahead and click on July. then click forward. And as you can see down here, there's a survey completion box. So you can see how far you've come along during your processing of your monthly activity report. So you click forward here. So this first part right here gives you a view of what's going to be coming down during the activity report, but it's just for again a visual view without any inputting records that you need to do. So this gives you a good view of what we're going to be asking. So here's the first input box. So let's say my organization, the Perry's Family Organization, my system navigation goal, let's say it's 20 a month. All right, so I really need to hit that 20 a month system navigation encounters goal. So as it says right here, here is where you input your healthcare system navigation encounters. So here are the buckets that we have, and we're going to go over this in detail when Jess comes on. I'm giving you the functionality first, but here are the buckets of encounters right here. So let's say the system navigation encounters, I had 10, so I did a really good job, 10 encounters. So out of that 10 encounters, this part is optional. I had 5 touches with application assistance. I had 4 with health coverage and 1 with primary care. And that makes my 10. That is great. So I got my 10. It reflects the total 10 healthcare system navigation encounters here. So I did not have any other, and Jess will go over a little bit more in detail what the other is here. But there's an other box here. If you can't figure out a category or a bucket of encounters your particular, you have a question about, you'll go ahead and type it in here and add it. So we can keep track of that specific encounter you can't find that fits in any of these categories here. So good, we didn't, there's our 10 encounters, our 10 healthcare system encounters up here that reflects that. We'll go ahead and move down here. All right, so out of that 10 encounters, what counties were those in? Let's just say Perry County, and I had 5 in that county. And my son, let's say Jack, my 6-year-old county right here, he had 5 in his county also. So that makes up our 10. So that reflects everything, how it is implemented. Here's your 10 touches, and 10, you know what? I'm not going to give him 5. He doesn't deserve that. I'm going to give him 1. There we go. That's better. So there's our 10. Those are 10 right there. So along these lines, so we have our healthcare. This is our healthcare system navigation segment here, our little area. So if you have anything that we have quantitative information, if you want to write in, just as we had in our old documents, we had our quantitative where you can write in anything. Feel free to write in any type of comments, questions that support anything that we need to see, that you need us to look at, have issues with. Again, Jess will go over a little bit more in detail of what this box means. So you can go ahead and type anything in here with the quantitative information. So that page is really set again for our healthcare system navigation encounters. So great, I have everything in. I got 10 here, and it looks like I need, I'm going to need 10 more somehow. So I'm going to go ahead and move forward here. And as you can see, we're going to jump into, I'm going to really show you, it was wraparound services, but we've changed it to social determinants of health section. So now if we scroll down here, we're halfway through our completion of our survey / monthly activity report. So we're going to come up here, and here's what the bill is going to look like. Health system navigation, non-medical, aka social determinants of health. And here are our buckets that are part of that collection of encounter or data points. So right. So great. Let's just say I'm going to hit my 20 right on the nose. We had another 10 here, which is great. So that we've hit our goal for the month of 20. We had 10 healthcare system, and we had 10 social determinants of health encounters. So that hits our 20. So good job. Give yourself a nice pat on the back. I had talked to 5 food and had 5 referrals to the other programs. Again, we've given you 3 more options here to go ahead and input anything that you don't feel like it fits in any of these categories. All right, so you can type them in and write your number of encounters. Again, a reflection of the healthcare system navigation part. It shows the total number of system navigation divided out by county. So we're going to do the exact same thing. We're going to write in Perry and Jack right here, and we'll say, I'll be nice this time. I'll give 5 and 5. So there's our split up of 10 encounters. Here's our breakout of the 10 right here, and here are how it breaks out in the counties that you guys serve. Again, and there's another quantifiable a part where you can write in comments, questions. You can really detail out what your work has been and any concerns that you have. And so, perfect. So I've done that for the month of July, and I'm going to go ahead and press forward again. And it says your monthly activity report has been successfully submitted. It's 100% complete. Now you're going to have to, here's the thing, is you're going to have to go back out, refresh it, come back into that link. And now I'm going to start all over with August. Same process again for August. We're going to start all over. I'm not going to go through and bore you guys with everything, but it's the same process for August and September. So that is a little bit of how this functions. It's pretty basic and easy. Now, I think the big thing that you guys are going to have questions about is the content and where things fit. And that's where we're going to go ahead and turn this over to Jess. Our ROC team has put together a supplemental guide that will go along with this that should help answer any of the questions you might have. I'm going to bring up the supplemental guide, and we do have a few scenarios that we'll be going over after Jess is done, and we'll go ahead and walk through that. So let me go ahead and bring this guide up. Perfect. And I'm going to go ahead and turn it over to Jessica Diaz, and she'll go ahead and talk through the monthly activity supplemental guide to help you guys out. So go ahead, Jess.
Hello, everyone, and thank you so much, Perry. Let's see. So we put together some additional information to help everyone sort of come to shared definitions and understanding of what some of the different moving parts of the reports should look like. We started out by defining what we mean by healthcare system navigation, which is any help that you as grantees provide to individuals and families in navigating healthcare eligibility and actually accessing those medical benefits. And so we have a few examples of what that would look like. And I want to double check with you, Perry. I have written here that a single encounter may include multiple types of activities and that you can have multiple encounters with the same person. I noticed in your example there was no overlap, but I think it is very possible and likely that you may have, for instance, more than 10 and 10, because those may be the same people sometimes, and we do want to count those. Does that sound correct?
Yes, you're correct.
Okay.
Yeah, you are correct. I didn't want to confuse in the functionality of it, but you are correct.
Yeah, so it's very possible, it's possible to have one encounter where you talk about everything on the list. That is potentially possible, and we completely understand. And so when you're looking into those optional sections about what the different activities within the encounter were, you may have 10 in total system navigation individual encounters, but it may add up to something that looks like 40 if you were to add up all the pieces below. So there is not a one-to-one connection here. And if you talk to someone one day and talk to them the next day, that's 2 different unique encounters. So no worries there if your numbers don't all add up to exactly 100%, but if they are less, then that could be a problem. So you might want to do some data checking there. So as Perry showed you, there is a section to put how many individual system navigation specific to healthcare encounters. And we wrote out a little bit more about the different sections in that optional encounter topics area. So the first three on the list, and you'll notice it's changed a little bit. I think streamline might be the right word of the different categories so that they are grouped a little bit based on the kind of activities they are. The first three are specific to helping people navigate the eligibility and enrollment part of the healthcare system. And this is really focused on if you help someone with a new application, if you help someone report changes or renew their current medical benefits, or if you help someone understand notices from the agency. So that's the first three. And then we have some different metrics. The first one is about just anything you do that explains what is and isn't covered by OHP. So any questions about health coverage, any help with using health coverage, I think this is going to be a category that almost always gets marked for every encounter. And then we go into some specifics underneath. So we talk about fee-for-service specifically and coordinated care organizations. So if you help either explain what fee-for-service is, you help someone make a connection to a fee-for-service provider, you are that fee-for-service provider, and you talk about what that means, all of that would fall under the fee-for-service bucket. And if someone is a CCO member or will become a CCO member and you help them connect to the CCO, you help them understand what a CCO is, or if you are a CCO provider, that would all fall under that bucket. And then there are other specific types of benefits that we felt were valuable to call out and collect data on. One of those is primary care. Clients may need help understanding what it is that they have access to from a primary care physician and how to get one and why it's important. So if you are helping someone understand or successfully connect with a primary care provider, you should mark for that encounter that at like +1 primary care. A big part of this is also helping people understand how to successfully connect with their providers and schedule those appointments. So any activity along the line of helping people understand how to schedule appointments to helping them make those appointments or being the person they are scheduling appointments with, that would count for this next bucket. We also wanted to call out specific underutilized services. So right now it's all sort of in one central bucket, but if someone needs help with understanding or using their dental, getting non-emergent transportation, connecting with a behavioral or mental health provider, we would like you to mark it in this next bucket. And another important thing is language access. So we know that our community partners are a really important force for equity when it comes to helping Oregonians get care and get information in a language that they understand. And we want to help you get credit for the work that you do there. So there is a section specific to language access, and that's inclusive of both interpretation or translation. Realizing I started talking really fast. So I'm gonna breathe. Okay, and jump right back in. Another one that I think is something that historically our grantees may not have gotten full credit for the help that you all are doing in helping people understand and resolve any billing concerns or problems that they have. And so we have put that as its own metric as well. We know that, you know, none of us are islands and we're all working together. So if there's anything relating to healthcare or medical needs that's beyond what you do at your organization, we have a section where you can mark the referrals you're helping people make with other health or medical programs. And then last but not least, as Perry mentioned, there are some sort of empty buckets for if there are other important activities that you want to track and let us know about. We recognize that we think we know what are useful metrics, but you are the experts in the work that you do. So that other section is a great place to put, for instance, ooh, can you go back a little? Sorry. Yeah, right there. So if you're helping people connect with, for instance, other types of coverage that aren't OHP, if you're helping people connect other dots, that's a great place to put in that referrals, and then maybe even specify in more detail in the other section or add to that qualitative section. I did see, so this last part about the healthcare system navigation count is by county. I saw someone ask about what if people help across many, many counties and they don't all fit. Perry, I'm gonna say probably that's why we have that qualitative section. It's a big empty box for people to put in any other information that doesn't fit, both in the quantitative or qualitative realm. What do you think about that answer?
Yes, I agree with you 100%.
Awesome. So I think the county is one where we would hope that the numbers would match up. So I don't know of people who live in more than one county per se. So it would probably be one county per household that you're helping, or your best sort of proxy for that. And then I think just for data collection purposes right now, if you can fully type out the county name, that'll make the data a lot easier to deal with. So if it's Multnomah, spell the whole thing out. And now we can move on to the social determinants of health. So now I have sort of an extra definition here on top of what's in this section, which is for folks who maybe aren't familiar with the term social determinants of health, we switched from calling it wraparound services to the social determinants of health because we do understand that a lot of how healthy someone is, their opportunities to really access their ideal wellness, it's going to depend on a lot of factors that are not strictly medical. So those are those conditions in the environments where people are born, live, learn, work, play, worship, and age. And that affects a wide range of health, functioning, and quality of life outcomes and risks. So that's one reason why we've reframed this a little more. What we really mean are the things that aren't strictly medical. And so those are things such as making sure people can keep stable housing. They're able to have healthy food and know how to prepare it. Any sort of non-medical benefits that people need access to, and that can be a whole range of things. We have a few specific ones that we've called out, but just like the last section, there is this other, so that you can really make it your own. And if there's an important social determinant of health that you either are making referrals or doing in-house, we want to know about that too. So we have that other section as well. And you'll see the ones we currently call out are food, housing, childcare, jobs or unemployment, and then the referrals you're making to other programs. And just like the last section, specifying where folks are from who you're helping. So I live in Clackamas County, so if someone were to help me, they would put Clackamas and number of encounters 1. And so that's just a very quick run through. And then Perry mentioned that the qualitative box is pretty much a catch-all for all the things that you want us to know that don't fit above. It's pretty much, is there something you've been doing? Is there a situation you've seen a lot of? Are there specific issues that you think we should know about at CPOP? We wanted to give you an opportunity to put that in too. All right, so we wanted to do a little bit of thinking about how this looks in the real world. So we have put together 2 scenarios, and I would love for you to put into the question box after I read this out loud. I guess we can't put up the sections and the scenarios side by side. So try your best to remember, and we'll work through it together, I think. Maybe what are those sections that you think would apply for this scenario? So here is scenario number 1. Someone calls your office looking to apply for OHP for their family. They mention that their child was recently in the emergency room and they have bills from last month that they don't know how they will cover. Together, you walk through the application and successfully submit it, making sure to include a retroactive request for the previous month. They're approved. You explain that the approval includes coverage for the time period the child was in the ER, and walk them through how to talk to the hospital to rebuild those emergency services and what their temporary fee-for-service covers while they wait to hear from their CCO. The applicant mentions that they would like to connect with their CCO to learn more about the services available to members, and so you provide them with the information to contact their CCO and ask if there is anything else you can assist them with. They say yes, and you do a warm handoff to folks who will help them apply for rent assistance and monthly food boxes from a local church. And let's see, wonder if we could reopen. Yeah, exactly. Maybe we start with the healthcare aspects. Oh, look at that. Thank you, Perry. Oh, I think that should work if you do the thing where it automatically does half.
So Jessica, and I apologize, my allergies are acting up today. There's questions in the question box about the link or the reporting process. Do you want me to ask those questions, or do you want me to wait because they'll be answered as you go through this activity?
I think that, do you all mind if we go through the at least scenario 1 first? I think we have enough time. If anyone has questions about the specific categories, maybe those are good ones to answer now, but if it's about the process itself, I think maybe we can circle back. What do you think? Okay.
I think just go for your activities, and then I'll look at the questions to see if they answered while you're facilitating the activity.
Oh, thank you. All right. So of this list, which are the things that we did in this scenario? Ooh, I see we're starting to get, we have an answer. A good answer.
I can read it out loud.
Sure.
Yeah, looks like the following encounters are billing, application assistance, retroactive assistance coverage, benefits, FFS, and CCO, social determinants of health, food and rental assistance. And then the next response is new application, bill, CCO, FFS, rent, food. And I'm not sure about anyone else, but I can't hear. I don't know. Can everyone hear us?
I can hear you, Liliana.
Yeah, I can hear you too. Yeah, I think it might be, it seems like it's some of our colleagues that can't hear us. So it might be a system in our thing, but the community partners are able to hear us. So I apologize for continuing to ask that question.
Yeah, oh yeah, and health coverage.
Yeah, health coverage.
Yeah, and instead of me just telling you what we should mark, I was really hoping that we could sort of make it a little more interactive. So thank you so much to the folks. We have a few folks who have offered those sections, and yeah, I think you have it completely right. This was a new application, so it's new application assistance. We talked about like what their health coverage will look like, specifically about billing, specifically about fee for service and what CCOs do and how to connect with them. And there might be other things that you talked about, like this is just a simple scenario, but you can also add quite a few other things in here if you read between the lines. But I think we really did get we got a pretty good picture of this, including to the social determinants that we also helped address. Sweet. I think we're ready for scenario 2, which I think is a little more straightforward. I'll read it. You've been Logan's CP for 3 years. Logan comes to you a couple times a year for assistance in navigating OHP. During their recent visit with you, they share that their address has changed and would like to know what new providers may be in their area. You assist Logan with these changes and get them connected with their CCO to find a provider close to their new home. Due to this new address, Logan asked for recommendations on childcare providers in their neighborhood, and together you and Logan called 211 to learn about available options. So for this encounter, I'm curious what our CPs think are the good categories to mark for this encounter. And I'm also hoping that putting it into scenarios makes it feel a little more real and logical for you all.
I think you're doing a great job at popular education, Jessica. And so the person wrote renewals, report changes, CCO, childcare, and 211. And then someone else wrote social determinants of health, childcare, reporting changes, referral to healthcare. These scenarios are great examples. So you have great feedback.
Thank you.
Does 211 or childcare, does 211 and childcare 1 or 2?
Ooh,
So I'm assuming, are they 2 different categories?
Yeah, that's a great question. So if we look at, let's see, can we go down to where the actual boxes are really quick? Here's what I would say. I would count it in both. It is a referral to another program, and it is helping someone access childcare. So you've done both in one. And hopefully you've also modeled in the process that people can call 211 on their own. So they've learned about the resource and they've learned specific information about childcare providers. So this would be a 1 for the non-medical encounters, but you might have multiple boxes below where you're putting in information as well. So that is a great question. So it counts as 1 in the big bucket, but you can separate it out to say, in this encounter, I did 2 or 3 things. I hope that makes sense. Yeah, and I'm seeing good creative juices flowing too, because people are connecting the dots that if you're helping someone connect with a provider in their new area, that's probably their primary care. So that is making sure people have and understand how to get adequate primary care.
And you have validation, yes, and thank you. So people are understanding it.
Awesome. Those were our 2 scenarios. I know we went through them and I talked really fast. Sorry. But I hope that helps. And I think we have plenty of questions. So I'll stop talking and we can listen to you all a little.
So here's a question that just,
yeah,
sorry?
First of all, before we take the questions, I want to let everybody know that I will send out the PowerPoint. I will send out this supplemental guide to you guys, and we have recorded this meeting also. So I'll send all those 3 things to you guys because we've recorded this presentation. We'll send them all out to everybody. So sorry, Lily, go ahead.
So the first question is, because these reports are monthly, does each CBO have to keep sorry, I'm having a trouble, keep a report and then report at the end of each month? Assimilation. Keep an assimilation report and then report each month.
Yeah, I mean, I would
Sorry.
definitely, yeah, I would accumulate the data within your organization, however you guys are looking at setting that up. Again, your setup, you can really connect with your rocks and how you're going to set your system up and accumulate this data. Then yes, you're going to report it all out once through the link.
Each encounter involves several calls and texts. Do we count each of the calls and texts as an encounter?
I think so. So if
Yes.
I'm the person you're helping and you talk to me today and I have more questions tomorrow, that's a completely new set of things you're doing with your time and energy. So yeah.
In order to count the encounter of the assistants, do they have to be certified?
That's a good question.
No. No, you don't. They don't have to be certified. A certified assister? No, because I think some of this work a certified assist, non-certified assister can do. So to stick with how we've counted metrics in the past till now current, no, they don't have to be a certified assister to count the data.
I think I would
Thank you.
put a caveat in that there were 3 sections that were specific to application assistance and enrollment. And so if you're helping someone with a new application or their renewal, those people should be certified because we do train on how to do that work.
Yes, most definitely.
Thank you for putting together the guide and online reporting. Will they be available in Spanish? Our staff that is doing the reporting would very much appreciate having available the reporting link and guide in their first language for accurate reporting and tracking navigation purposes.
Yeah, I'll most definitely look into this. I'll need to dive in with my contacts that created this and see what their abilities are, and with my team. So most definitely, I'm going to look into this for everybody to make this easier for our community partners.
I wanted to check in. I think I saw a question or two about helping to understand what the fee-for-service metric meant. Is that a question we should circle back to? You know what, better safe than sorry. I'll go ahead and talk a little bit. So because people may be in a CCO or they may be fee-for-service with their coverage, these really are catch-all buckets for any time you're discussing or helping people with anything specific to getting care, using their benefits if they are fee-for-service, or maybe helping them navigate becoming fee-for-service or transitioning from one to the other. Fee-for-service is when, instead of having that coordinated care organization help you with your care and making sure that, as a whole person, not just as your physical health or only your dental health, you're getting help. But we do recognize that some people do not have that coordinated care. They instead have a fee-for-service, which bills directly to the state. So if someone's in a state of transition, you may talk about both fee-for-service and coordinated care organizations, or if they're already a CCO member, you might talk exclusively about things that relate to being a CCO member. So that is that differentiation there. Oh, and fee-for-service is another name for open card because we're really good at our many jargonistic and acronym-filled phrases.
We
So
love
sorry about that.
acronym soup, but we're trying to be better. Is the survey in Word/Excel?
The survey that you're seeing is web-based. Again, I'm not a computer guru, but I don't think it's either. It's through the web. And go ahead.
Oh, this guide is Word-based, so you could use it to build an Excel or Word tool of your own, I believe.
Yes, I usually PDF the guide and send it out. But maybe for you guys, if you want to build off this document, I will send it to you guys in Word format so you can use it internally to collect data or to help you, get a little push start for you guys. So that's a good, thanks for bringing that up. Maybe I'll go ahead and send it both ways for you guys so you can use what we've created for you.
Awesome, thank you. So again, another question, will this report be available in Spanish?
Yeah, let me work on that.
And we have quite a bit of, like, we will bring back more information on that, Perry, and I can support you. Word, please, for so yes, I think many of the partners would like also the Word document.
Yeah, that sounds, yeah, not a problem.
I see a host of questions from before well, maybe right as I started talking that I think we could go over. Let's see here. Are we differentiating between OHP and Callum touches is one question. And those both count as an OHP level of benefit. So right now we don't have any metrics that ask you to specifically call out Callum versus other types of OHP. I would say if that's something that's really important to your organization, you could add that in as one of those other metrics that you want to track. But right now we're not asking you to differentiate between like what level of OHP you're helping someone with. And in fact, you could help out with an OHP application for someone who is not actually eligible. That still counts as the application, even if then there isn't a follow-up activity because they were denied. I see, do we list the county where someone lives or where you helped them? And I would say it's where the person lives. So you may be based out of Jackson County and someone's calling you all the way from Coos Bay. And so I'd say put where they reside, where they spend most of their time, and not where you are. I think that's the metric we're looking for.
So there's two questions that I think are pretty important here that haven't been asked. What if we what if we help navigate and apply from Marketplace?
Yeah, I think that's another great place to use the other healthcare system navigation category. If you do a lot of Marketplace or OHIM work, that's a great place to put it. Oop, Perry's navigating right to it. And you can specify, like maybe you did 5 OHIM applications. Oh gosh, my acronyms. You could write that in here.
Are we collecting data on race and ethnicity for applicants?
We are not doing that in these reports. That is information where if it is put into the OHP application, it is generally being tracked, but that's not part of what we're doing here in this particular report.
You said that you were sending us all this info. Yes, this will be sent with, and this is being recorded as well. For July and August, we kept tracking of these items and called them touches. However, we do not categorize them. How would we use them?
I think that if there was no differentiation between the different types of touches in the past, that's okay. It is an optional section, and we recognize that it's hard to build data on something that you didn't know about. And maybe it'd be good to focus on moving forward. What's the best way to collect this information or to tell the story of the excellent work that you do?
So is the application assistant section specific for MAGI or non-MAGI programs only?
Yes, we're asking for helping people with Medicaid and CHIP programs, which is, yeah, that MAGI, non-MAGI, the types of things you can put into the one system.
So, and then there's another Spanish one. So Perry is going to be working with that, and we'll be having that conversation with our team. If we are also doing wraparound support under other COVID equity grants with OHA, may we report these numbers here, or do these numbers have to only reflect the clients that we are helping with OHP navigation?
Good question.
That's a good question, and that's the best thing that we could do to differentiate. Whatever you know, if you're working as an FTE with the CPOP grant and your FTE is being funded by that, do your best to your ability to collect that data that's centered around our funding. I know it's sometimes hard to do that if you're an FTE and you have multiple funding streams and being supported by that. But do your best to have your data reflect the work that's centered around this grant.
And then another question. Can we ask why you are not tracking race and ethnicity info in this report?
Yeah, I think, well, Perry, let me know if I have this right, but one big reason is that would be a pretty big burden on you all to collect everyone's REAL-D data and store it separately than the OHP application when you're also doing it there. While we don't have immediate access to the information put into the one system, that is being collected there and that is being used. So I think at this point, I would rather you have your time and energy working with clients to help them feel comfortable putting that information directly into the application where it belongs and not reporting it to us separately, because that lives in the one system.
Yes,
So
and also the way this survey is set up, it is not secure enough to I know you want to collect that information, but I don't want to go down that road of possibly having somebody's name being put in here and race and ethnicity being collected. So that's why we're not collecting that, and like Jeff said, we're collecting that data already in the one system.
What a great point. Yeah, don't put any personally identifiable information for cases into this form, please.
So this is a JI question. I apologize, I didn't see it at first. If release inmates, you want the county of release counted with doing over 250 applications a month, that is a lot of extra data to be counting.
It's a great question. Maybe we can follow up separately since that's a pretty unique situation going on there, and we want to work with you on that.
Let's see. Since we just got our contracts and not necessarily have the system set up to gather all of the required data during July, August, and September, can you tell us what reporting is required for these months?
Yes, what is required right here is the total number of healthcare system navigation encounters. And the other number that is required is the total number of social determinants of health encounters. And you'll see again, there's optional language here. When it's optional, it's optional. So those two numbers are required.
And I imagine we're asking you to do your best to give us a good, reasonable number, recognizing that you maybe didn't have the systems in place to do like a encounter-based process of getting these. I think we're just trying to get a feel for the work that you have done as best as you can share it with us for the months in the past.
Yeah, most definitely, Jessica. That's a good point. We've been doing this work for a while, you guys, and we're in a transition period right now. So we'll work with you the best that we can, and email us and if you have questions, because we're transitioning, obviously, and so we'll work with you as best as we can.
And I see some folks mentioning that these categories are optional now, but what happens in the future? And I think that's a great thing to ask, because we are looking to work with our community partners to see, I hope I did a good job of sort of explaining the why as we talked through some of these different categories, that it's really there so that we can show people the work that you do and the things that they might not be thinking about, that you are providing value to your clients and to Oregonians in general and the systems that we work in. So we want to make sure these categories are meaningful to you. So there may be some small changes we may continue to adjust in order to help you all really tell the story of what you're doing with our grant money and what you're doing at your organization. But yeah, there will be sections that may change. We are hoping to collect good data on these different metrics because we think it's important and we think leadership and decision makers should know. But we'll be building that with you.
Want to provide feedback that our CBOs who blend funding for our work, they are required to only count FTE on the grant. Makes the reporting complicated. Or, sorry, I am having the hardest time today. Yeah, it is complicated, sorry.
So I think the question is how to separate out the work that different people are doing depending on their funding. And I think what we're hoping for is information specifically that relates to OHP especially, but it doesn't have to be a one-to-one, like only things directly funded by us can get counted here. I think it gets more complicated when it comes to COVID because that is health and healthcare. And that might be something if you do want to report it as one of those others. That way we can separate it out a little bit. But I don't know, Perry, did I do that at all justice?
Yeah, it doesn't happen to a lot of our organizations, but yeah, you did it justice. And if there's, again, it's kind of one of those things. If you have really specifics about FTE and the different funding streams, just reach out to me and we can walk through some scenarios. And because that's definitely in the weeds type of questions sometimes. So always reach out and we can talk through your scenario.
And I see a question about if the documents are fillable. So I think there's a few things we've been showing. One is a web-based fillable document, and that would be filled out once a month by one person. So it would be adding up all of the encounters all of the folks have done in your organization. The other document is just a Word document guide that talks a little bit about why we're asking these questions and what types of things should fall under those different buckets. And I think we've heard either we might be able to make or give you this raw information here so you can make something like an Excel or a Word document to track this throughout the month. And so then you have something that's easy to put into the monthly report at the end.
Could you share the questions and answers that are being asked in this training?
I believe this training is being recorded.
Yeah, it's being recorded, like I said, and we'll send this out.
We do not have a total number for social determinants for the last 3 months. We only have the health navigation numbers for the last 3 months. What if we don't have the social determinants numbers at all? I
would say use that, just go ahead and write in why that is. And here, I would put your explanation in this little spot. So it'd be probably 0 right here. And then you would come down here and use this quantitative little box to write in, we just started and we weren't collecting this information. We'll let you know. Just give us a heads up on your comments of why that is. And again, that's fine. Again, we're in a transition period, and just make sure we're all communicating using not only this email link and and you can email me also with any questions. So please go ahead and put your clarifying information in these boxes. Sorry, I'm starting to stutter now. Oh, it's 2:58.
Thank you, Perry. And I'm seeing a lot of comments of appreciation to both you and Jessica. And my eyes are super itchy, so I apologize if I didn't ask all of the questions exactly how they were asked. So please forgive me today. I'm not my normal 100% self, Liliana.
That's not acceptable. Sheesh.
Okay, so here's another question. I don't send my reports. I fill them out and submit them to my supervisor, and she reviews them before sending it onto you. Can this be saved and sent to multiple people after completed?
I think the important part here is that the online portion can't be saved and returned to. You have to fill it out all in one go. And there should only be one report per month, I believe. Does that sound right, Perry?
Yep, that is correct. One report submitted per organization. That's really gonna really gonna mess a lot of things up. So that's a good point and good question. So yeah, one report per organization submitted.
And I'm seeing there is a lot of interest in maybe getting more of a base document to work from. So I think we'll talk about that as a team and see what we can do to help meet people's needs. And it's 3. Wow, time flies.
Then,
Yeah.
You know what?
One more
I think
question?
I have an idea, which is that in addition to everything we've been talking about here, your monthly check-ins with your rocks is a great place to continue to have these conversations and to find what works for your organization, because we recognize that like one size does not fit all. You're going to have things internal to what you do at work that might not be applicable across the board. And then I bet that Perry would be a great person to turn to after you talk to your rock, or in addition, probably set something up in the future if you need more one-on-one guidance.
It sounds like that is a great idea, and I think that for the rocks to connect with their community partners to make sure that they understand the reporting process. So thank you so much, Jessica.
It helps when I get to give other people work.
Sorry. Right? No, it's okay. That's all the questions as of now. I don't know if anyone wants to type in one last question. Nope. And I'm seeing a lot of gratitude, Jessica and Perry. So maybe you all are a dynamic duo and should continue to do these great examples and dinámicas.
Yeah, well, I just appreciate the rocks, and I appreciate Jess, and because I know enough to be dangerous along these lines. So thank you for the team, and thank you, community partners. Again, I think the biggest thing that we all have to remember before we sign off here, I'll get this, I'll get the PowerPoint sent out. I'll get this Word document sent out with the guide, and also the recording sent to everybody. And please, let's all work through this as we transition from that great spreadsheet that we've used for years to this online browser link that we can capture data from. Because as we capture data, we can really do a lot more with it now. And you'll see the outcomes of after we capture a few months of data. We'll share with you how this is looking from a community partner's point of view. So thank you all, and our team respects of everybody, and very much gratitude for our community partners. Thank you, and I'll get this information out to everybody.
Thanks, everyone. Thanks, Perry.
Thank you, guys.
Bye.
Bye.